Welcome to these additional episodes of Your Pregnancy Week by Week. We're going to provide information about things you may want to know about before baby's birth and in the weeks and months after baby arrives. Dr. Glade Curtis and I hope these discussions will help you and your partner settle into your new roles as parents. The information in these episodes is a general informative guide. None of the information we provide is intended to replace, countermand, or conflict with the advice given to you by your own doctors. Always follow his or her advice. Use the information you learn here as a starting place in your dialogue to help you put your life with baby and after pregnancy concerns, questions, or interests into words. Each episode will cover one topic. Our discussions are intended to help guide you through the many new experiences awaiting you. So let's get started on this discussion. We're going to talk about using acetaminophen, Tylenol, during pregnancy. Is it safe? Pregnancy can be a time of discomfort for many women. As baby grows, so may your aches and pains. Back pain may be one of the most common discomforts you experience. As your tummy grows bigger and you gain weight, there's more stress on joints, which can cause back pain. Acetaminophen is often recommended to treat minor aches and pains during pregnancy. Up to 65% of pregnant women in the United States take it. Is it safe to take while you're pregnant? We once believed a pregnant woman could use Tylenol during pregnancy with impunity. Today, we do offer some precautions. The American College of Obstetricians and Gynecologists encourages pregnant women who believe they need a pain reliever to talk with their doctor before they use any product. They state a pregnant woman doesn't have to avoid acetaminophen in situations where it may be beneficial, but they recommend always taking the lowest effective dose for the shortest amount of time. But some studies have raised questions about its safety. These studies have suggested a link between the use of acetaminophen during pregnancy and abnormal fetal development. Most studies focused on ADHD, attention deficit hyperactivity disorder. Other developmental issues examined include autism, delayed language, behavioral issues, and cerebral palsy. Use of acetaminophen during the second or third trimester of pregnancy appeared riskier than use in the first trimester, and the longer you take the medication, the higher the risk appeared. Most studies found short-term use of Tylenol had minimal risk. Other studies suggested taking acetaminophen during pregnancy might change how the reproductive tract develops in unborn baby boys. The risk seems higher when used at the end of the first trimester and the beginning of the second trimester. During this time, the reproductive tract develops in an unborn baby. The risk was highest when the medicine was used for over 2 weeks during that time period. So what does all this mean? The common belief is that acetaminophen is okay to use during pregnancy if it's used correctly. You just want to avoid overuse. A major warning is to be careful with any medicinal products you take during pregnancy. It's easy to overdose on acetaminophen because it's in more than over 200 over-the-counter products. You can find acetaminophen in pain relievers, fever reducers, and cold and flu products. And how many of us use more than one product to treat an ailment? You need to be very cautious when you take an over-the-counter product to treat a condition or illness when you're pregnant. If you take more than one product, it could be dangerous because you could overdose. So what should you do? Before you take any product, always read labels. Many contain precautions for pregnant women. Don't take more than one medication to treat a cold or flu symptoms. Always take the correct dose. And don't take acetaminophen for longer than 2 or 3 days without first checking with your doctor. Remember, during pregnancy, 2 people are involved, you and baby, so take good care of both of you. If you'd like to read about baby, check out our book, Your Baby's First Year, Week by Week. We cover many of these after pregnancy subjects that deal with baby in the book. We know you're busy and you may not have much time to devote to reading, but our book covers baby's development and growth in a weekly format, so you don't have to digest too much information all at once. Each week is a fairly quick read. If you want to find out more about this podcast, visit our website, yourpregnancyweekbyweek.com. If you're looking for something specific, check out the podcast topic lists on the website.